We all know someone who's uninsured. They're our family, our friends, our neighbors. More than 48 million people lack health insurance, but that's about to change because help is on the way. Soon, millions of uninsured Americans will be eligible for affordable health care coverage. But most have no idea these changes are coming. This means we have some education and awareness work to do. To begin, every state will soon have a healthcare marketplace that will enable uninsured individuals and families to shop for coverage. What brings you here?
I don't have insurance. It was too expensive through my job. I'm young, I'm healthy. I opted out.
But now you're injured and have medical bills.
Yeah.
Did you know that on October 1st, you and millions of uninsured people will be eligible to sign up for affordable health care coverage?
Really?
Your state's new marketplace will help you shop for insurance that's right for you. In fact, you may be eligible for free or low-cost coverage. Financial help will be available based on how much you make.
Sounds like a good deal and the smart thing to do. How do I sign up?
You'll shop for insurance online and compare different plans. Based on your information, the marketplace will help you select the right plan.
Yeah, that sounds good.
Patients and families clearly have a lot to gain. Your hospital has a role to play too.
I've heard a lot about the healthcare law, and I know it's helping people already. I just wish there was more we could do to sign up people for coverage.
There is.
Really? Like what?
Well, starting in January 2014, your hospital will be able to enroll people in Medicaid on the spot, even in the emergency room, so their care is covered immediately. It's called presumptive eligibility. Patients fill out a very short application, and if it looks like they're eligible for Medicaid, the hospital can provide them with temporary coverage on the spot. Patients then have time to fill out the official application.
But what if their eligibility isn't confirmed?
Medicaid will still pay for the care you've already provided, and then you can work with the patient to get the right kind of insurance.
That's great!
Doctors often find themselves answering questions about insurance.
You know, there's one other thing I want to ask about.
What's that?
It's about health insurance. I know there are changes coming. Can you help me understand it all?
Here are a few things you should know. Soon, all insurance plans will have to provide complete coverage. And insurance companies can't reject someone for having a pre-existing condition. So you can get and keep coverage, regardless of your medical history.
Wow, that's great.
And now all insurance plans will have to show what's covered in simple language with no fine print gimmicks. So you'll know exactly what you're paying for. And of course, people can now receive important preventive services, like mammograms and colonoscopies, with no out-of-pocket cost.
So where can I get more information about all of this?
There's a couple of good places. You can visit healthcare.gov, which explains everything. Another group called Get Covered America is helping people get the information they need. Know the facts.